Closer to home, many Indian workers, especially in the informal sector, are more vulnerable due to lack of mental health support in their work environments. Harassment, discrimination, long working hours, and stress are common, yet mental health resources remain scarce for this section of the society. Creating mental healthy workplaces is not just a moral responsibility, but a strategic imperative. The Government of India has recognized this and has been actively formulating policies and launching programs aimed at building a resilient ecosystem that supports mental well-being across all levels of society, including the workplaces. To address the increasing mental health challenges, Government of India has undertaken several key initiatives. One of the foundation efforts was the introduction of the National Mental Health Policy in 2014, which established a comprehensive framework to integrate mental health services into the general healthcare system. This policy emphasizes equity, access, and quality of mental health care for all the citizens. Building on this, the Mental Health Care Act of 2017 was a landmark step towards ensuring that every individual has the right to access mental health care. The Act adopted a rights-based approach aiming to destigmatize mental health issues and ensuring that those who suffer from mental illness receive treatment with dignity. It also outlined a framework for providing mental health services at primary, secondary, and tertiary levels, thus ensuring access at every level of the healthcare system. The district mental health program under the National Mental Health Program has been crucial in making mental health services available at the grassroots level. Today, 767 district mental health units are operational across the country, providing both outpatient and inpatient services. These units are staffed with qualified mental health professionals who offer treatment to a wide range of mental health conditions, from depression and anxiety to severe disorders like schizophrenia and bipolar disorder. Furthermore, through the Ayushman Bharat initiative, mental health services have been integrated into the Ayushman Arogya Mandirs, which provide care for common and severe mental health conditions. These centers are essential for offering mental health services at the community level, making support more accessible to people in remote and underserved areas. While these initiatives laid a strong foundation, a crucial part of today's discussion is how Telemanas has revolutionized mental health care delivery in India. Launched on October 10, 2022, Telemanas is an innovative digital mental health program aimed at reaching the unreached. This initiative was designed to be the digital arm of the National Mental Health Program, providing 24/7 services to 24/7 mental health services, especially for individuals in the remote and underserved areas of the country. In the 2 years since its inception, Telemanas has handled more than 14 lakh calls, providing support in 20 different languages through 53 Telemanas centers across 36 states of the country. This has made mental health care accessible to people across India, ensuring that no one is left behind due to geographical or financial considerations. Today, we are taking the Telemanas a step further by launching the Telemanas app and video calling feature. These new tools will make mental health support even more accessible. The app provides users with an interactive health platform where they can access mindfulness exercises, mental health tips, and even games designed to promote well-being. More importantly, the app will offer confidential mental health support anytime, anywhere. The video calling feature is another important upgrade, allowing mental health professionals to conduct more thorough assessments through video consultations. The feature, launching today in Karnataka, Jammu and Kashmir, will be rolled out across the country shortly. It is expected that it will greatly enhance the quality of care provided through enable brief physical and mental state examinations. Coming back to today's theme, it is important to note that workplace mental health is not just about addressing the mental health needs of the employees after problems arise. It's about building resilient, supportive work environment that proactively promotes well-being and prevent mental health issues. This requires a multi-pronged approach, which includes creating policies and frameworks that foster mental health resilience, ensure mental health support in informal workplaces, which often lack structured healthcare systems, and promoting holistic practices such as yoga and meditation as preventive strategies for maintaining mental well-being. In this context, India is uniquely positioned to lead the way. Our rich tradition of holistic healthcare practices like yoga and meditation can play a pivotal role in promoting mental health at both formal and informal workplaces. Today, we will hear from experts across fields about how these practices, along with structured policies, can be integrated into our workplaces to foster a mentally healthy workforce. I'm also excited to share that today we will be releasing two important documents. The Telemanas Rapid Assessment Report, developed in collaboration with the World Health Organization and NIMHANS, and the second document is the self-care booklet titled Taking Charge of Your Mental Health Because It Matters, which provides practical guidance on maintaining mental well-being, particularly in the workplace. In addition, today's event will feature roundtable discussions with experts from diverse sectors, including representatives from NIMHANS, AIMS, IBAS, WHO, FICCI, and CII. In conclusion, today's event is not just about celebrating achievements, but about charting the future course for mental health in India, particularly in our workplaces. As we move forward, it is crucial to embrace a multi-stakeholder approach involving governments, industries, civil societies, and healthcare professionals. This is to create work environments that prioritize mental health. Let us make today a turning point, one that fosters open dialogue, builds collaborative solutions, and ensure that every individual, regardless of where they work or live, has access to the mental health support that they deserve. I would like to thank all of you, and I look forward to the rich discussions and learning we have in store for today's discussions. Thank you.
Thank you, sir. I now invite Dr. Rodrigo H. Ofrin, WHO representative to India, to deliver his address.
Thank you very much. Ms. Aradhana Patnaik, our ASMD, Minister of Health and Family Welfare. Mr. Saurabh Jain, Joint Secretary, MOHFW, and Dr. Pratima Murthy, Director, NIMHANS. Good morning. We are here today to mark World Mental Health Day, to increase conversations and promote actions to support mental well-being for all. But first of all, a very big congratulations to the Telemanas for huge achievements in just 2 years. This year's theme, Mental Health at Work, highlights the profound connection between mental well-being in the workplace. With 60% of the global population in work, addressing mental health in workplaces is not just an option, but an urgent necessity. Just think about it, we are at work more than 8 hours for many of us throughout the day. And it is usually the cause of our mental health stress, as you would say. In India, with its dynamic economy and a vast workforce of over 500 million people, mental health challenges in the workplace have emerged as a growing concern. Or maybe we are not detecting it as much as well. Fast-paced economic growth, high job insecurity, gender inequity, disrespectful workplaces, unsupportive colleagues, and physically challenging working environments are some factors that place significant stress on workers all over the world. Stressful or unsupportive workplaces can lead to negative mental health outcomes. For employees and contractors, long working hours, high-pressure environments, and lack of work-life balance are key stressors. India also has a large informal workforce where employees' lack of job security and stable incomes further exacerbate mental health vulnerabilities. All these factors raise the risks for anxiety, depression, and burnout. Workers, particularly those in the informal sector, often have little or no knowledge about mental health issues and lack of access to mental health care. Poor mental health also affects an employee's capacity to perform, leading to absenteeism, reduced productivity, or lower job satisfaction, all leading to poor productivity. Despite growing awareness, especially during COVID-19, when everyone experienced mental stress one way or the other, mental health stigma remains a significant barrier in all countries all over the world. Employees struggling with mental health problems often don't seek support, fearing discrimination or job loss, or even a renewal of contracts, preventing them from seeking help. Employers have a big responsibility, and I'm happy to hear that representatives of the private sector are also here. We must create supportive work environments for promoting mental health and well-being. Employees who feel supported are more likely to experience job satisfaction, stay engaged, and be productive. Sometimes these are not health interventions in the workplace, but actually our own HR and hiring policies. Creating such safe spaces at work involves raising awareness around mental health issues and training managers to address them, as well as implementing wellness programs at the workplace. For example, initiatives that offer employees regular mental health check-ins have been shown to reduce stress and increase engagement. In some places, it's just a peer counselor that is provided by the employers. In other places, there is already what we call a mental health leave. So it's not part of your sick leave, it's just for you to have a mental health break. For employees experiencing mental health issues, employers should offer reasonable accommodations such as adjusted workloads, flexible hours, or remote work options. This ensures that employees feel supported without sacrificing their mental health. For workers in the informal economy, policies that can provide mental health coverage and protection, such as access to health services or even telemanas, or stress management programs are essential. Investing in mental health services for these workers will not only improve well-being, but also enhance overall economic stability and productivity. Now towards telemanas. In India, telemanas, the online teleconsultation platform, has played a huge role in delivering health services and also breaking the stigma around mental health. A WHO review of telemanas has shown it to be a successful model for mental well-being and support, and can be transplanted, adapted in other countries as well. It has the potential to be utilized by more people in need and even expand in terms of referral to other mental health issues or other health services. For example, a person who is under stress, a simple question, and I've discussed this a lot with Dr. Pratima, you will also ask, how do you cope? More likely or not, someone will be using a substance, either alcohol or cigarettes. Then you can be referred again to tobacco cessation or alcohol cessation. So telemanas can be an entry point for other problems. And I congratulate MOHFW for 2 years of a very successful implementation of telemanas. We have seen it in the States. Adolescents are a very big demographic of users of telemanas. Showing that there is really a need for us to continue and strengthen the telemana services. Primary healthcare, especially Ayushman Arogya Mandirs, also has a role to address people's needs for mental health care and raise mental health awareness in the community. Synergies with primary healthcare services together with telemanas will really redound to huge achievements in improving mental health and well-being of the population. Of course, as WHO India will continue to extend all technical support to the ministry for any of these further expansions. Building resilient workplaces in India requires a collective effort from all stakeholders: employers, employees, governments, and mental health professionals. Together, we can create an environment where mental health is prioritized, stigma is reduced, and every employee has the opportunity to thrive. On this World Mental Health Day, let's recognize that the mental health of our workforce is the foundation for a healthier, more productive India. It's time for employers, policymakers, and individuals, as well as employees themselves as peers, as peer counselors, to commit to building workplaces that truly support mental well-being for a healthier future for all. Thank you. Dhanyavad.
Thank you, Dr. Offrin. I now invite Ms. Aradhana Patnaik, Additional Secretary and MD, National Health Mission, to deliver her inaugural address.
A very good morning to all of you. My greetings to all of you on World Mental Health Day. Dr. Rodrigo, WHO representative to India, Dr. Pratima, Director NIMHANS, my colleague Saurabh Jain, Joint Secretary in the Ministry of Health and Family Welfare, KK Tripathi, Economic Advisor, other representatives of Ministry of Health and Family Welfare, ED, NHSRC and his entire team, various development partners, organizations, ladies and gentlemen. A warm welcome to all of you on World Mental Health Day. I hope all of us sitting here are free from anxiety and tension. I'm correct? So let me start with a small story. So one person, an employee of an organization, it was a very reputed organization, used to have a very strict and very, temperamental boss. The term, khadoos, which we say. So this khadoos boss used to daily, harass this employee. He would complete his targets, but yet the boss would again give some additional work if he finished, before time, so that he would be required to stay late till night, and would try to find out, even small problems or even small mistakes. He would be given a firing, that you are not competent, you are not able to do. So all the definitions of a khadoos boss was there in that person. And this person was a very docile, sincere, hard-working person, and slowly started getting depressed, and he then started taking it out on his wife at home, wife and his children at home. So now his life in office as well as in house also started becoming hell. Then suddenly one day he met one of his old college friends, school friends in fact, school friends, and somehow he bumped into him, and when they met, so this boy, when he was a boy, basically this man, when he was a student in college, was very jovial. So his friend noticed that this person has changed a lot. He looked very serious and very old, very dejected sort of. So he asked him. And this person narrated the entire story, how his khadoos boss has been totally harassing him, and now it is coming on his family. Now he has regular fights with his wife, and also he keeps shouting on his children, and he feels very bad about it, that he cannot control it. So his friend gave him an idea, and he implemented that idea. So once he started implementing the idea, then after a few days, his behavior at home changed. He was as earlier, he started behaving well with his wife and his children, and there was no problem at home. Of course, the khadoos boss continued with his behavior. So then his wife was quite surprised that पहले तो ऐसे इतना आके चिल्लाता था घर में, अब क्या हो गया अचानक. So his wife also thought कि पता नहीं कोई और लड़की मिल गई क्या, अब यहाँ पर आके मुझे कुछ परेशान नहीं करता है, कुछ ही नहीं कर रहा है, and he's very happy at home. Yeah, has he started drinking or gone into some bad habits due to which now at least in family there's no issue. So one day what she thought was, after he finished his office, she was there outside his office, and she followed him कि कहाँ जाता है ऑफिस के बाद, ये कहाँ जाता है, किसी जगह दारू पीने जाता है या किसी लड़की के यहाँ जाता है. So then he followed him, and she followed him, and then she saw he went near the office, around 5 kilometers away from the office, there was a jungle sort of, and a place where the man went, and there was an effigy he had made of his boss there, and he took out his sandals and shoes and started hitting, and he would just give out all the जो हम लोग कहते हैं ना टिपिकल गाली हिंदी में, जितनी भी प्रकार की गालियां हैं वो पूरा उस पर निकाला, and he did it for half an hour. आधे घंटे तक उसको जितनी गाली दे सके, जितना दे सके, and जूते को बार बार मार के फिर लाकर फिर मार के फिर करते 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 in half an hour, and then he was like happy, and then he went back home. So the moral of the story is we have to find solutions to our own problems. We should not escalate our problem. There's a solution to each problem, and I think this applies to all of us in the workplace who are working day, night, and because most of our, the day time we spend in office. So the productive time, the effective time of our entire, 24 hours, almost 8 to 10 hours in Ministry of Health and Family Welfare. I keep saying it's almost all of us spend more than 10 hours. So it is the crucial morning 9 to late night 9. It's almost 10 to 12 hours everyone spends, and if that is not as per our requirement, then somehow it has an impact on the entire daily affair, the night affair, and the entire family affair, the entire life of the person. So it is very essential that we have such, some such remedial courses for the people who still are in tension. We need to provide a good environment in the office. That is important. Work is important, but apart from work, you also have to keep yourself effectively engaged so that you give productive results. So this is for office, but also at home front also many times there are many people who have tension in office. So I remember there was another person who used to say कि we have a खड़ूस boss, and what they used to talk behind the person, जरूर आज घर में बीवी से लड़के आया होगा इसलिए यहाँ डांट रहा है सबको. So again, home front is also, one should not, take that out in the office, or the office tension should not go home. That is one thing which we say in work-life balance for all officers like us. I have been trying to, myself practice it for the last 25 years of my service, keeping work away from my home front. So that has really helped me balance both. The second, which I feel we need to now focus on, today we are celebrating 2 years of Tele Manas. This has really brought revolution thanks to Dr. Pratima and her entire team who has worked on it and got it implemented, and the officials in the Ministry of Health and Family Welfare got it done. A few things which I was thinking that should need to be added. Today we are already launching the Telemanas app and also the video calling facility. But one thing which we need to do is more of IC on this, because during my field visits, I generally found the awareness was not there at the lowest level. So then after returning, I sent a letter also to all the states that you need to bring it down to the village level, because if you go to the Ayushman Arogya Mandir or when you interact with the villagers, all of them today are aware of 102, 104, 108. Similarly, 144, 16 should be in the mind of each and every person. Same thing we should do for schools and colleges, that all students are able to access. Today we have a very limited number of students calling in this number. I was just going through the figures. Out of 14.5 lakhs, most of the calls come from between 40 to 50 age group, the 35 to 45, 50 age group people. So that is basically people being troubled with their family life or with their office work. The adolescent group, they are around 10 to 15% of adolescent group are in our ambit, but we need to increase it, because if you just do an analysis, a person at the age of, no one should die young, or no one should die before the age which is defined for the person. We always say कि जन्म और मृत्यु ईश्वर के हाथ में होता है. No one knows when we will die or when we will come into this world. But when we are there in this world, we need to ensure that we lead a happy, contented life, even if there's less of money, less of requirements, or less of worldly pleasures, as you may say, yet one can remain happy and contented. So for that, the adolescent age group, I was just thinking, and yesterday I was discussing with my team in the ministry, the adolescents are nowadays becoming very anxious and very impatient. Students not getting full marks, wanting to commit suicide. shocking. We, in our generation, people used to fail, still they would be happy. बिकॉज ठीक है, हो गया, माँ बाप से 2-4 डंडा पड़ गया, टीचर ने 2 थप्पड़ लगा दिया, ठीक है, हो गया, बट दोस्त मिल गए तो दोस्तों के साथ फिर हंस खेल लिए, भूल गए, अगली बार देखा जाएगा. एंड पेरेंट्स वुड ऑल्सो से दैट ठीक है, अब अगली बार मेहनत करो, टीचर वुड से मेहनत करो, तुम पढ़ते नहीं हो, पढ़ाई करो तो तुम पास हो गए. So that was the resilience that our generation had. Nowadays, I don't know, maybe because we have not brought up our children in that environment, maybe we have given them such a cozy environment. Now children are so, temperamental, so they feel that if this is not achieved, then world is gone. That I think we need to address, because it's almost there in every family. I know my son is quite resilient, and usko bhi वैसे ही वो बनाया हुआ है. So he has his friends and he keeps telling me stories. कि मेरे ये मैं वो बोल रहा था कि नहीं मैं जाके सुसाइड, मेरा इस बार नहीं हुआ, इसमें मेरा इंजीनियरिंग में नहीं हुआ तो मैं कूद जाऊंगा. स्कूल इंसिडेंट्स हैपनिंग इन फ्रंट ऑफ द अदर चिल्ड्रन. So this is the age which we really need to target, because we are losing the future generation. माँ बाप पर तो क्या होगा वो जानते ही हैं, but it is an impact, direct impact on the society. So these adolescents really need to be handled with care, and I think Telemanas can do that. One more idea I had actually when I just joined as ASMD, I think after a month only we had this AFMC Pune call center, special cell being established, which is for the Central Armed Forces. So at that time I was just thinking, should we think of a dedicated cell for students, for adolescents, not students. There would be dropouts also for adolescents. They have lots of issues. Peer pressure, parents' pressure, the teachers' pressure, education, their own physical as well as psychological changes happening in the body. मेरी दाढ़ी नहीं निकल रही है, that is a tension of boys. So these are small things, but at times people take it to such an extreme level that the person goes under depression and anxiety and feels like committing suicide. मेरी तो जिंदगी में कुछ रह नहीं गया है. Such, I feel this is a big group, and I think it's almost in the entire society, be it rural or urban. More so in urban, mostly I have found, but also now it is going to rural also, because the aspirations of rural youth also has increased. They have access to mobile, so they also know a lot of things are possible, and if not, if they do not get it, so they also feel rejected. So this is one sector which is very close to my heart, because I have helped a few students come out of it also, my son's friends and all that, and some of my friends also in their workplace, in their, and some members in my family also. I have seen them go through this due to maybe, problems in the family or in the office or with the children. So this I think we should focus on, and I'm sure to be delving on various problems. Those who are causing this anxiety and depression in other people's lives, they also need to be counseled, because I feel they are also not normal. They also need counseling. So both things I think we should be targeting. And I'm sure today's workshop will be very successful. And from today, for 1 week, we have also sent letters to all the states to organize, awareness camps at the Ayushman Arogya Mandir, have various activities with school children, engage them, awareness on the Telemanas app, how to use it, and how to improve it, and lots of reports and assessment reports on all these to be launched today. All the very best. Thank you.
Thank you so much, ma'am, and thank you to everyone. As we all know, today is the 2-year anniversary of Telemanas. I invite you all to witness the journey of its journey in the last 2 years.
हर तरफ हर जगह बेशुमार आदमी फिर भी तन्हा आदमी। हम सब कभी ना कभी जीवन के किसी ना किसी मोड़ पर इस एहसास से गुजरे हैं। आज लोग समझ चुके हैं कि मानसिक स्वास्थ्य कितना महत्वपूर्ण है और इसके सही इलाज और परामर्श से जुड़ी सेवाओं का मिलना कितना जरूरी है। इसी उद्देश्य से भारत सरकार ने स्वास्थ्य एवं परिवार कल्याण मंत्रालय के सहयोग से आज से ठीक 2 साल पहले नेशनल टेली मेंटल हेल्थ प्रोग्राम टेली मानस की शुरुआत की। इस डिजिटल प्लेटफॉर्म की मदद से देश भर में काउंसलिंग, मनोविज्ञान परामर्श सहित अनगिनत सेवाएं उपलब्ध करवाकर राज्यों में मानसिक स्वास्थ्य सेवाओं को और मजबूती दी जा रही है। मानसिक स्वास्थ्य से जुड़ी किसी भी जानकारी और परामर्श के लिए लोग टोल फ्री नंबर 14416 पर कॉल कर सकते हैं। टेलीमानस लोगों की व्यक्तिगत जानकारी की गोपनीयता सुनिश्चित करता है और लोगों की सुविधा के लिए ये 20 भाषाओं में भी उपलब्ध है। टेलीमानस के इस सफर को आगे बढ़ाते हुए पिछले साल वर्ल्ड मेंटल हेल्थ डे पर भारत के माननीय स्वास्थ्य और परिवार कल्याण मंत्री द्वारा इसका लोगो लॉन्च किया गया। आज टेलीमानस सेवाएं देश के सभी राज्यों में 53 टेलीमानस सेल्स के माध्यम से उपलब्ध हैं। पूरे भारत में 14.6 लाख से अधिक कॉलों को सफलतापूर्वक संभाला गया है। इन सेवाओं को आगे बढ़ाते हुए रक्षा मंत्रालय के सहयोग से AFMC पुणे में सशस्त्र बलों और उनके आश्रितों के लिए एक समर्पित सेल स्थापित किया गया है। टेलीमानस की दूसरी वर्षगांठ के अवसर पर आज 2 नई पहल की जा रही हैं। वीडियो परामर्श अब टेलीमानस पर उपलब्ध होगा, जो पहले से मौजूद ऑडियो कॉलिंग सुविधा का एक और अपग्रेड है, जिसके द्वारा कॉल करने वाला व्यक्ति अब मानसिक स्वास्थ्य पेशेवर के साथ वीडियो परामर्श भी ले सकेगा। इसके अलावा एक व्यापक मोबाइल प्लेटफॉर्म टेलीमानस ऐप, जिसे आम जनता के लिए विकसित किया गया है। इस ऐप में आत्म देखभाल, संकट संकेतों को पहचानने और तनाव, चिंता और भावनात्मक संघर्ष के शुरुआती संकेतों को प्रबंधित करने के सुझाव शामिल रहेंगे। ये मोबाइल ऐप उपयोगकर्ता को तत्काल परामर्श के लिए 24/7 भारत भर में प्रशिक्षित मानसिक स्वास्थ्य पेशेवरों के माध्यम से मुफ्त और गोपनीय मानसिक स्वास्थ्य सहायता से जुड़ने में भी मदद करेगा। कहाँ खो गए हम, हर दिल में ये कैसा गुबार, कहने को सब कुछ है, फिर भी नहीं है कोई दिल हल्का करने के लिए एक यार। कहाँ जाएं, किससे कहें, टेलीमानस है ना आपका दोस्त हर पल।
So, as you have heard, the Telemanis app is a comprehensive medical mobile platform designed to enhance mental health services for the public. I request Ms. Aradhana Patnaik to formally launch the app on this Mental Health Day by pressing the button. Thank you, ma'am. Now I invite you to watch a short video about video consultations in Telemanas. Video consultations in Telemanas will enhance existing audio to call service, allowing mental health professionals to gather more information and conduct brief examinations, including a mental health examination. Yes. This facility will be launched in Karnataka, Jammu and Kashmir, and Tamil Nadu, and scaled up across the country. I request Ms. Radna Patnaik to launch the app, to launch the facility by pressing the button.
A caller reaches out to Telemanas services, and the call is answered by a Telemanas counselor who provides the first line of counseling. Once the call is transferred, the MHP then evaluates the caller and decides the need to speak with the caller over a video consultation. The MHP clicks on Initiate Video Call and takes the consent from the caller to send an SMS link for the upcoming video call. Once the caller and the MHP both join the video call, the MHP verifies and validates the identity of the caller and proceeds for evaluation. After taking history and examining the caller over video, the MHP can now mention a provisional impression and their recommendations in plan of management for the caller on the MHP screen. In case the MHP is a psychiatrist and a medical doctor, they can further fill the section of pharmacological intervention and prescribe the required medication to the caller if necessary. The link of the prescription can then be sent to the caller at the end of the video call. Through this new video calling feature, Telemanas aims to provide end-to-end care to the caller with a platform that is able to have a stepped approach ranging from counseling to prescriptions tailored to the individual needs of every caller.
I now request the dignitaries to release the WHO Telemanas assessment report. The WHO conducted a rapid assessment of Telemanas, coordinated with the Ministry of Health and Family Welfare, to evaluate its performance. The report highlights significant milestones in mental health support and commends the initiative's robust technological framework. I finally request the dignitaries to release the report, the booklet, Taking Care of Your Mental Health Because It Matters. The booklet emphasizes individual efforts to maintain mental health and well-being. Addressing common misconceptions on mental health only concerns those facing challenges.
Can I request the Telemanas team NIMHANS, IIITB, NHSRC to please come up on the dais?
Thank you, everyone. We will start with our first panel discussion of the day soon, so please remain seated. We will proceed shortly. If you would like to have a cup of tea or coffee, please feel free. We will call you back in a little bit.
annual steps, you need to you have to record.
Oh, I have to record.
Yeah, yeah,
Can I? But my question is that every people are going to sit here, na? तो मैं recorder table पर ही रखती हूँ.
I mean, you can just keep. हाँ रख दो ऐसे. I don't think there is a problem in that. कि आप यहाँ पे भी रख सकते हो.
As it will catch the voices from.
It will catch from anywhere.
Okay,
That's
great,
fine.
great. So मैं यहाँ रख दूँगी.
हाँ, it's good.
ठीक है. बस record ही press करना है ना? On और record.
Right, yeah.
ठीक है. May I request everyone to start taking their seats, please? We will begin in 2 minutes. I request you to please start taking your seats. We will begin very soon. Please start taking your seats. Thank you. Good morning, everyone. Please take your seats. I hope you enjoyed your little refreshment break. It is my pleasure to introduce our first panel of the day, Policies and Frameworks to Foster Mental Health Resilience in Workplaces. In this session, we will explore how integrating mental well-being support into organizational policies can enhance employee resilience. Our distinguished panelists will share best practices for supporting diverse employee groups, including those of different genders, abilities, and neurodiverse backgrounds. We'll also delve into the role of digital tools in self-care programs and the critical impact of leadership in building a mental health-friendly culture. Please join me in welcoming our chair for this session, Professor Dr. Atul Goyal, Director General of Health Services. Here you go, sir. Thank you. I now invite our distinguished panelists to the stage. Excuse me. Mr. Siddharth Bhattacharya, Secretary General, Nat Health. Mr. Siddharth Bhattacharya is a seasoned leader with over 25 years of experience in health, technology, and services across India and the US. He has held key roles at Dell, Philips, JVK, EMRI, and the Government of India, specializing in healthcare transformation and technological innovation. He is currently serving as Secretary General of Nat Health, where he leads public-private healthcare partnerships. Dr. M.S. Gautam, Associate Professor of Epidemiology and Public Health, NIMHANS. Dr. Gautam is an additional professor at the Department of Epidemiology at NIMHANS, Bengaluru, where he also serves as the head of the WHO Collaborating Center for Injury Prevention and Safety Promotion. He has developed several public health tools, such as the tool to assess and classify work-related stress, the NCD meter for workplaces, and the school safety assessment tool, among many others. Dr. Sameer Parekh, Director, Department of Biotechnology and Behavioral Sciences, Fortis. Dr. Sameer Parekh is an eminent psychiatrist and has played a significant role in enhancing the image and reach of mental health across the country. He is the Director of the Department of Mental Health and Behavioral Sciences, Fortis, and the Chairperson of National Mental Health Program, which is one of the few multi-city, multi-centric, mental health programs. Ms. Anupriya, Manager, Capital Mobilization, ABPN. Anupriya is a development sector professional and leads ecosystem building initiatives to facilitate capital flow through social enterprises and drive philanthropy and impact investment for the Sustainable Development Goals. She has co-founded SisterCare, a women's health platform focused on addressing polycystic ovarian syndrome and related issues. She is a social impact enthusiast who believes in empowerment through entrepreneurship. Right, sir, over to you.
Thank you so much for doing half of my job for introducing the panelists, which I requested you to. I have to listen today to what the panelists have to say, but may I begin the discussion with stating something which has happened in the past couple of months for that matter. There was this incident at RG Car Institute at Kolkata. We talk of mental health at workplaces. There are a lot of medical professionals here. Have we failed the system by looking at the mental health of the people who run our hospitals? Have we failed ourselves in the first place? That needs to be thought of. If you go around the country and look at the working conditions of the residents, nothing has changed. It is pathetic. So we talk of occupational health, we talk of mental health, but we don't look at our own backyard. So yes, panel discussions are important, conferences are important, even committees are important. Honorable Supreme Court has prepared a national task force which is meeting frequently. I'm also part of one of the committees along with Dr. Pratima, and we've had 4 meetings. We'll bring out a report as well. Will that change things on the ground? That's the important question. What we discuss here, will it lead to any change in the ground? We have a person from the industry, in fact, 2 of them. One of them is talking of, capital mobilization as far as resilience at workplaces is concerned. When will the government start thinking of motivating its own workforce? Will we let them work in the conditions they are? And since this is a program of the government, I think this thought has to come to the policymakers, whether we are looking at the mental health of our own people working in our own sector for the government of India. So with this, I will first pass on this mic to Mr. Siddharth Bhattacharya, who is sitting next to me, where again the question is, what role does industry bodies and associations play in advocating for better mental health policies, and how can the government initiatives and corporate policies align to create a more robust framework for mental health at work? Again, you are from the corporate sector, but I would like you to talk about certain initiatives that the government needs to take place, needs to develop for looking at the mental health of its own workforce. So we are not looking at only the industry, the government workforce as well.
So thank you, sir. Thank you, sir, for that, setting that context. The topic of discussion is very, very close to my heart, as well as probably one of the most, silent epidemics that, we will be facing in the coming years. We already have started seeing what, some incidents which you referred a couple of months back. About 150 million, probably the environment has 150. million mental health, people who would require mental health assistance. Nearly 75, 3 out of 4 are undiagnosed or untreated. And we have a scale problem, we have a reach problem, and I think some of the announcements made earlier today are steps in the right direction. A lot more, we'll have to do, and together with government and private sector. In my response, sir, to your question, I'm going to take on the federation hat and be mindful about the role industry federations can play working with government. I would like to take us back about 2 to 3 years back, and we are at the heart of COVID. And, what we
do. Talking about mental health, and that's I think we need to do regularly. The inclusive system, again, which has been mentioned by everyone. The diversions are all we mentioned as such. So I'll just give you one example as such. I know, I was in the army as a brigadier. I was adjudicator of the disability pension. That is given to individuals, or even after, if someone dies in harness in service, to the family. The family pension is double than the actual amount of the normal family pension amount. There was one case of suicide. This is one of the rare cases of suicide where the family got benefit, but which was attributable to service. There was one equivalent to the junior commissioned officer of Air Force. He was for one specific trade, and in that Air Force station, there was only 2 people of that particular trade. He was somehow denied work in that trade, and he was put on guard duties regularly. So the case came to me eventually that so-and-so suicide happened, and the suicide is not attributable till date in our government regulations as such. But when I read the entire noting, I went into details and all, I read the court of inquiry and all, and then we read the suicide note and all, where he written clearly that I approached so and so date and all. And he wrote clearly कि मैं उसके पास गया, मैं उसके पास सबने मुझे चाय पिलाई, बिस्किट खिलाए और भेज दिया. So for 1 year, he was under stress that I am not doing my actual technical job for which he was qualified, and he was doing a general duty job for which that qualification was not even required. And he was being quoted by other people who were not that qualified. And Air Force has got very, very highly qualified people in those technical skills as well, because you know of the machines which are there. So eventually we fought with the system as such. I was the adjudicator from medical side, discussed with the non-medical thing, then we went to the adjutant general also and presented the case, and somehow we couldn't help him during his life as such, but at least his family got the disability pension, which was made attributable to service. So we need to look at each and every case. We need to probably have that kind of channels open where people can go, and then action is to be taken, and that needs to be diaried. Even though armed forces has that, but sometimes there are breaks as such. So I think I'll stop here, but just before that, I must thank my own team in ED Secretariat for doing the literature review, and also they have made a very good acronym of PAUSE, P-A-U-S-E. P is encourage employees to take out time when needed, asking them to step away from stressors, and promote a culture that values work and time away. Assess, regularly check with employees about their mental health and workload. Unwind, provide resources and opportunities for employees to unwind, wellness program, mindfulness session, indoor-outdoor activities, anything. Team building activities. Solutions. Explore the solutions available to employees' challenges, whether adjustable workload or professional development or like work from home or any other kind of solution. And evaluate. Have an inbuilt system of evaluating your activities and also employees' workload, stresses and all also. So with that, thank you very much, all the panelists. Do we have 2 minutes for 1 or 2 questions, Dr. Neha? Just one or two important questions or comments, or sharing your this thing from the audience, please. I think everyone is hungry now. So I think we thank you very much once again, and thanks to Ministry of Health for this opportunity. Thank you.
Thank you all for this really critical conversation. I think it's a conversation full of nuance and layers, and that can continue. I'd like to invite Dr. Kotwal to felicitate our dignitaries with a token of our appreciation. Dr. Raghu Arakal, Deputy Director General Ayush, the Directorate General of Health Services, Ministry of Health and Family Welfare. Mr. Neeraj Jain, Country Director India and Director Growth Operations Asia, Middle East and Europe, PATH. Dr. Yutaru Setoya, Team Lead, NCDs and Comorbidities, WHO India. Ms. Rabani Banerjee, Head Growth and Strategy, Arogya World. And Ms. Atika Dhandia, Director of Training, Art of Living Foundation. May I just request you all, may I request Mr. Saurabh Jain to please felicitate Dr. Kotwal with a small token. Please do come in front for a photo. Thank you so much. Before we close this event out, we thought it would be important to provide you all with a small meditation tool that you could also use in your day-to-day life, whether at work or at home. Ms. Dhandia, if I may request you to initiate the meditation, would you like?
All right. How about a quick one? Yes? Are you ready for it? Yes? So, it is a very good idea always, before you eat, you go from the fight and flight mode to the rest and digest mode. And meditation helps you to do that. Yeah? Ready? Let's just sit comfortably and easily. Relax yourselves. Sit back. Do not cross your legs, your arms, and just close your eyes. Take off your glasses, put them on the table. And let's close our eyes. Take a deep breath in and breathe out from the mouth as if you're breathing out from a straw. Take another deep breath in and breathe out from the mouth as if you're breathing out from a straw. Purse your lips. Let the breathing out be longer than the breathing in. One last time. Let's take a breath in and breathe out from the mouth. Relax your feet. Relax your legs. Relax your abdomen and chest. Relax your shoulders and arms. Relax your neck muscles. Loosen them up if you want to by moving it. And now relax all your facial muscles. Your lips, your cheeks, your eyes, your eyebrows, forehead, the top of your head. Relax your entire body. Relax your entire body. Your entire body. Take another deep breath in and breathe out from the nose this time, very slowly. One more time, take a deep breath in and breathe out. For a few moments, I want nothing. For a few moments, I do nothing. For a few moments, I am nothing. Achaha akinchan aprayatna. Drop all efforts, mental and physical. And completely repose in the self. शारीरिक और मानसिक दोनों चेष्टाएं छोड़ के सिर्फ विश्राम करें। Astoma Sadgamaya Tamsoma Jyotirgamaya Mrityurma Amritam Gamaya Om Shanti Shanti Shanti. The body is still and the mind is getting stiller. Take another deep breath in and breathe out. Taking another deep breath in once again. Become aware of your body and surroundings. वातावरण और शरीर के प्रति सजग हो जाएं. And taking your own time, very slowly, gradually, you may open your eyes. समय लेते हुए अपना धीरे धीरे आंखें खोलें. Take your time, do not be in a hurry. Good morning. Good? Was it good? How many of you felt relaxed? Yeah. Now the food will get digested better. Enjoy the day. Thank you.
Thank you so much. Now that we're all relaxed, it's time to reflect on the key insights and look ahead at the next steps. To deliver a summary of the session for the entire event and share some valuable pointers on the way forward, please join me in welcoming Mr. Saurabh Jain, Joint Secretary Policy, Ministry of Health and Family Welfare.
Respected dignitaries, esteemed panelists, and distinguished guests. So it's been a very productive forenoon session of lots of panel discussions. Lots of insightful discussions has happened during the last three and a half hours. Now it is very important to reflect on the key takeaways from these sessions and to chart a path forward for mental health in the workplace. The discussions we had today underscore the critical need to prioritize mental health not just as a healthcare issue, but as a fundamental component of well-being in both formal and informal workplaces. In our first panel discussion, we delved into the necessity of creating robust policies and frameworks to support mental health in workplaces. As discussed, several organizations are already incorporating mental health support into their operational policies. But the need for scalability and inclusion remains paramount. The key points from this session was, first of all, the scale of problem was discussed, and it was mentioned that the prevalence rates of stress are very high across the organized sectors and also the unorganized sectors. And it was also mentioned that not only the corporates, the private industries, but also the stress in government institutions should also be looked into, including the private, including as mentioned by DGHS, that all the healthcare providers, the kind of mental stress that they have to go through in their day-to-day functioning also needs to be looked into by all of us. And then the key factors that were related to the stress at work was mentioned, and it was mentioned that work style, hours, role conflict, role demands, career progression, work-life balance, organizational support, all these are factors which are affecting and creating the stress at work. Some of the potential solutions which has come out after deliberations by the group includes making provision of health and safe workplace a mandate for all organizations. The panel deliberated and they came out with the conclusion that it is very important to provide safe working conditions, and this has to be given priority, and for that the global policy also mandates that for companies to enforce such stable, safe working conditions. The panel also discusses about the task of creating awareness among the employers and the employees about various kind of mental issues that they are facing, so that an early intervention can be taken and these issues can be resolved at a very earlier stage. It was talked about the employee resilience and skill building, and it was deliberated that development of communication skills, coping with stress, in addition to awareness and providing first aid training to employees can be considered. In this respect, in fact, one of the discussions point was also about how we are, as a society, we are growing, our next generation, how they are being grown up, and what is the kind of resilience that they are incorporating. So that also was discussed, and it was also emphasized that the upbringing of the next generation, the kind of resilience that they should have, the kind of stress resilience and how to handle the stress should also come, and it has to be taught even from the family itself. The panel also discussed various interventions that talk about bringing a sense of well-being, a sense of belonging, and community-level activities like group events, which are not lost, which can also be helpful, as was discussed, the professional interactions, the professional cohesion, that is also important for ensuring that the stress at the workplace can be reduced and the feeling of togetherness can be enforced. Nimaz talked about the various tools which they have developed for reducing the workplace stress, and it was discussed that these tools need to be scaled up for addressing workplace stress. The panel finally deliberated and they came to the conclusion that mental health problems needs to be addressed, but how exactly this needs to be done, integrated in the workflows, needs to be discussed. And more evidence needs to be generated on quantifying the productivity implications for organizations. The role of Telemanas in ensuring that the mental health services are provided to the unreachable population was also discussed, and the efforts of the Ministry of Health and Family Welfare in this regard was also lauded by all the panelists. This panel 2. Okay. The second panel discussed around the second panel discussion addressed mental health challenges in informal workplaces, such as those in the gig economy, daily wage laborers, and migrant workers. This discussion highlighted the unique challenges faced by these groups, such as lack of access to formal mental health practices, social stigma associated with mental health issues, which prevents workers from seeking help, Innovative approaches such as leveraging the Ayushman Arogya Mandirs and Tele Manas to reach these vulnerable populations. The points of discussion that came out from this panel discussion was that the informal sector, which comprise 80% of the Indian workforce, still faces multiple challenges such as poverty, debt, and lack of health services. Many of the panelists were of the view that the mental health is at the very bottom of their priority, and their other livelihood issues has more prominence in their lives. Mental health care must address these issues and must be integrated with the physical health. Then there were challenges of integration which was addressed, and mental health services such as Tele Manas, which is not fully integrated into the programs like Ayushman Bharat was discussed. In this respect, the panel feels that civil society can play a key role in raising awareness and connecting workers to services. Labor policies and registrations and labor laws and platforms like eShram was discussed, and it was discussed that these portals aims to provide security, but their impact on informal workers is limited due to weak implementation and low participation. The role of civil society was discussed, and civil society organizations can, like Jan Sahas, they have mentioned that they help the linking the informal workers to government schemes, particularly for migrant laborers who often face exploitation and lack access to mental health care. Preventive approaches were discussed, where it was the entire panel was of the unanimous view that prevention and awareness are essential. Initiatives like Tele Manas and Ayushman Arogya Mandir wellness packages, including yoga, are valuable, but stigma and access issues still persist. There are barriers to access where there is a severe lack of mental health services for informal workers, particularly for severe conditions. Increasing mental health literacy and equitable access is critical, as was discussed by the group. The group came out with various recommendations, which includes integrating the mental health with the overall health services provided by various primary, secondary, and the tertiary sector, like in the case of Ayushman Bharat, and addressing various social factors like poverty and migration to resolve the mental health issues of informal workers. The civil society and government collaboration was discussed, and a consensus is reached out that both has to collaborate to ensure last mile access to mental health services, and utilizing platforms like eShram, where all the data of informal workers are being collected, can be utilized by both government as well as civil societies to consolidate this collaboration. Skilling programs also, that was in fact one of the very good point that has come out, that a lot of informal workers are being registered in various skilling programs. So if the mental health can be added as one of the component in these skilling programs, this will help the workers to detect their mental health issues at a very early stage, so that it can be addressed properly. The resource centers, dedicated resource centers should be established for providing mental health support, legal aid, and access to services for migrant workers. And there is a need was felt for a cross-ministry collaboration, where all the ministries have to work together to develop policies that ensure mental health is a key part of worker welfare initiatives. The final panel focused on preventive mental health and the role of holistic practices in maintaining well-being. We learned about the benefits of integrating indigenous knowledge, yoga, meditation, and other holistic approaches into daily routines. These practices are not only effective for individuals, but can also be incorporated into workplace wellness programs. The panel emphasized the shift to be taken from treatment to prevention with a focus on early intervention. Ayushman Arogya Mandirs can be positioned as key venues for promoting these preventive mental health practices at the grassroots level. The panel discussed about a large number of employees are going through the stress, and there is a need for having a work-life balance. The gender stereotyping has to be addressed, and there is a need to ensure that the safety at workplace should be ensured through job security, as well as to ensure that the employees are properly relaxed in terms of the HR policies. They should not be, there has to be a proper leave management system so that when they are on leave, they should not be disturbed. The working hours should be fixed so that the employees can go back to their homes, relax, and there should not be any kind of intervention or disturbance from the employers during that time. The majority of the employees, it was mentioned that even after COVID and even after a lot of awareness programs, even the majority of employees do not share about their mental health at workplace due to the stigma attached. And a Deloitte survey was quoted where it was mentioned that the financial implications due to the mental stress at workplace cost around $14 billion for India. Resources for mental health are limited and not available, and challenges that we face are the resources, from where these resources and when these resources are needed for mental health care. The panel comes out with the recommendations that the vulnerabilities have to be recognized and cross-cutting factors like gender, socioeconomic status, education, age should be recognized. The recommendations given by the panel includes creating a safe workplace by proper HR practices where discrimination, harassment, sexual harassment at workplaces, violence at workplaces can be dealt with penalties and measures. Worker rights needs to be valued. Leaders to model the right behaviors, as was mentioned, our role models, the leaders should also practice what they preach. So that is very essential because the society looks into them and they adopt those behaviors. The leaders should identify and address the real issues contributing to workplace stress, and interventions around the inclusivity opportunities to discuss appraisals was also mentioned during the panel discussion. A lot of emphasis was created about creating of awareness of employees and employers and recognizing how each one of us is contributing to the workplace culture. It was mentioned that it is not just yoga and wellness which should be integrated into the workplace, but yoga and wellness should be integrated into our whole life. The panel discussed about the psychosocial interventions where simple therapies can be provided to people in the community. Dr. Sitoya mentioned about the friendship bench for simple problem-solving techniques. Physical activities should be promoted in the workplaces in any form, which can also reduce stress to a significant extent. And the HR policies and the employer should support workers with mental health conditions because through studies it was found that 20% of people will have experienced depression in lifetime, and they need systems to support and accept them even after recovery. It is very important to ensure that there has to be a work-life balance, work-life integration, and not only mental health, but physical, emotional components as well as needs to be addressed. Throughout today's discussion, one theme stood out: the remarkable success of Tele with over 14 lakh calls handled in the last 2 years. Tele has become a lifeline for millions of Indians seeking mental health support. The launch of the Tele app and the video calling features today marks a significant step forward in extending this support even further. By providing 24/7 confidential access to mental health professionals, the app and video calling features will ensure that help is available to everyone, anywhere and anytime. Looking ahead, we will ensure that Tele will expand its reach, particularly in informal workplaces, as came out during the panel discussions, where workers may not have the same level of access to mental health resources. This is where digital platforms like Tele can play a transformative role in making mental health support more inclusive. As we continue to explore ways to make workplaces mentally healthy, the discussions today have shown the importance of integrating mental health support into organizational policies. But the responsibility does not lie with organizations alone. Leadership plays a critical role in shaping the work culture, and it is imperative that the leaders demonstrate a commitment to mental health. Promoting a supportive work environment will not only improve employees' well-being, but also boost productivity and engagement. Moving forward, there is a clear need to scale up successful policies from today's discussion and apply them across both formal and informal sectors. The role of holistic practices in preventing mental health issues was a key highlight of today's discussion. Practices like yoga, meditation, and other indigenous techniques should not be seen as supplementary, but rather as integral to maintaining mental well-being, particularly in high-stress working conditions. We need to focus more on prevention and early intervention, ensuring that mental health becomes a priority at all stages of life and work. The Ayushman Arogya Mandir are well positioned to promote these holistic practices, and the challenge now is to ensure their effective integration into the workplace wellness programs. The way forward, as came out during the discussions, is first of all scaling Telemanas. From the ministry side, we must continue to expand Telemanas, ensuring that it becomes a cornerstone of mental health support, particularly for those in the rural and informal sectors. The integration of telehealth into broader mental health strategies will be crucial for reaching the last mile. Workplace policies, organizations must adopt inclusive mental health policies that cover all employees, especially vulnerable groups such as gig workers, differently abled individuals, and gender minorities. Leadership training should be prioritized to foster empathetic and mentally healthy work environments. Preventive care and holistic practices. We must focus on preventive mental health by incorporating holistic practices into workplace wellness programs. This includes scaling initiatives through Ayushman Arogya Mandirs and other local healthcare platforms to ensure that mental health care is accessible at all levels. Collaborative approach is needed, and it is essential to encourage multi-stakeholder collaboration between government, healthcare institutions, civil society, and the private sector to build a comprehensive mental health ecosystem that supports both formal and informal workers across the country. In conclusions, today's discussion have set the stage for actionable steps towards a future where mental health is prioritized at every workplace, formal or informal, urban or rural. As we move forward, let us carry the spirit of today's dialogue into our policies, programs, and workplaces, ensuring that mental health becomes a collective priority for all of us. I would like to thank you all once again, and I would look forward to continuing this journey with all of you. Thank you.
Thank you, sir. I'd now like to invite Dr. Neha Garg, Director at the National Health Mission, to deliver the vote of thanks.
As we wrap up our event for the day, I would like to deviate a little from what we call a formal proposal of vote of thanks and rather call it expressing my gratitude for the day. So please bear with me as I stand between you and a sumptuous lunch. My gratitude is first due to the leadership of the Ministry of Health and Family Welfare, especially Ms. Aradhana Patnaik, Additional Secretary and Mission Director, for her vision and motivation. Ma'am's wide experience and her special interest in the cause of adolescent mental health was invaluable in shaping today's program. A very special thanks to my boss in the workplace, Joint Secretary Policy, Shri Saurabh Jain. With his positive nature, balanced approach, and nuanced guidance, Sir led the team to bring this event to fruition. My heartfelt thanks to all the session chairs, Dr. Atul Goyal, Dr. Pratima Murthy, and Major General Professor Atul Kotwal, and all our panelists. Your experiences and solutions have helped us see that mental health is a shared responsibility, not just an individual issue. The engaging discussions of today have generated enough food for thought and learnings that we take back with us to translate into action points. My thanks are due to all delegates who joined us in person or online. Your engagement has been invaluable. Now to the people who make it happen, the dynamic Telemanas family. A big round of applause for NIMHANS team, led by Director Dr. Pratima Murthy, Dr. Naveen, Dr. Swati, please. The IIITB team, led by Dr. Shrikant. The NHSRC team, led by the Executive Director, Dr. Kotwal, and of course, the Mental Health Division at the Ministry. Thanks are also due to Dr. Seema from NIMHANS, who worked on the booklet, Taking Charge of Your Mental Health, and made it possible in a record time. She could not join us today as she is not well. My thanks are also due to the WHO team, country office, CRO, as well as the headquarter for working on the Telemanus assessment and the report. We are grateful to the print and digital media for covering today's event and helping to spread our message. A big thank you to the PATH team, led by Dr. Neeraj, Dr. Swati, Dr. Rachna, Dr. Ajay, Dr. Bhushan, Dr. Abhishek, and all others whose name I may have missed. Your exceptional support in the technical and operational aspects of this event has been crucial, but more importantly, your positive and prompt approach has been unprecedented and the basis of this successful program. We appreciate your partnership. Thanks to Anhad, who beautifully held together today's program as the anchor. I also want to give a shout out to Ms. Anika Singh from Voice and her team, who literally burnt the midnight oil yesterday, working on a special part of today's program. Last but not the least, my thanks to our mental health team at the Ministry. We are a small team, but we come through every time. Your hard work and going beyond the call of duty is well appreciated. A big round of applause for Ms. Rajni, Ms. Rujuta, Ms. Prachi, Ms. Shruti, Mr. Manoj, Mr. Manish, Mr. Shashank, Mr. Ajay, Mr. Murari, and everyone else. Finally, thanks to the events team and hospitality extended by Le Meridian. My sincerest apologies to anyone whose name I may have missed, but our gratitude flows to you as well. Thank you all for your participation and commitment to this important cause. Together, we can make a difference. I now request all of you to join us for a lunch before we disperse. Thank you very much.
Thank you, everyone. Have a good afternoon. Please join us for lunch and to continue these discussions on your left and my right.